Before I introduce Anthony Levinson, I'd like to introduce his colleagues, the core team that developed the portal. That's Maureen Dobbins and Brian Haynes, John Lavis and Parminder Raina, along with Anthony Levinson, and the countless supporters behind the scenes, the developers of the portal, many of whom are here today. I want to especially thank Ilana Chura, who's keeping this on track tirelessly, and her team, and my right-hand person, Laura Harrington, who is the Managing Director of the Labarge Initiative. It's now my pleasure to invite Anthony Levinson to take the stage and introduce us to the portal, finally. Anthony is the Director of E-Learning Innovation in the Faculty of Health Sciences. He holds the John Evans Chair in Health Sciences Education and is an Associate Professor in the Department of Psychiatry and Behavioral Neuroscience.
Thank you very much, Susan. Chancellor Labarge, Minister Wong, Dr. Kelton. I noticed it used to be in the bio, it used to say the youngest endowed chair. I guess we're all aging optimally. I'd like to start a little bit. First of all, I'll just echo Susan's comments. This is very much a team effort, so I'm pleased that so many people from our teams are here tonight. There's probably too many to thank, but I'm just the front face tonight of what is a very large group working behind the scenes, and a history of a culture at McMaster that is dedicated to reliable evidence. So I think this is building on our vintage, if you like, at McMaster University. I'm going to start with a brief video that introduces some of the concepts of the portal, and then talk a little bit about the faces of people we hope to help through the McMaster Optimal Aging.
Aging can sneak up on us, but we're living longer than ever before. Optimal aging means staying healthy, active, and engaged for as long as possible. What can we do to stay healthy? There's a lot of information available about healthy aging. It can be overwhelming. How do we know what information we can trust? The McMaster Optimal Aging Portal can help you sort through all this information and uses trusted sources to find answers to your questions based on research evidence. It'll help you filter out the noise so you can manage health problems and adapt to life's stresses and challenges with confidence. Access summaries of research studies and stay connected through email alerts. See how the contents of other websites are rated based on evidence, and read insights from experts in optimal aging. Whether you're an older adult, a caregiver, clinician, public health professional, or policymaker, the McMaster Optimal Aging Portal is your gateway to evidence-based information on optimal aging.
What was discussed today was the concept, I thought, at the symposium, that this is a hub of credibility. And I think, you know, what we're trying to capture here, and it will be a work in progress. We will keep learning from people, learn from our seniors, learn from our caregivers. But I think that notion of starting a dialogue, making what has been you know, an outstanding service from Brian Haynes, from John Lavis, from Maureen, available for the good of all Canadians and really a global audience. I think that's really what your gift has enabled, and what the culture at McMaster has brought forward. We hope that Linda is going to get help. Linda is divorced mother of two. She is a middle manager. She has a friend that's recently been diagnosed with breast cancer, and she's now wants to know what she can do for her health. She's interested more than ever and motivated. She wants to know, will yoga help? Is that, should she be doing Nordic walking or regular walking? What does the evidence say about that? She's spending a lot of money on vitamins. Her friend did too, and it didn't seem to help. Is that credible? She can go to the portal and she can get some answers to the best of the evidence that says out there. Janine is struggling a little bit. Her father fell and had a hip fracture. And there's questions now that she has. Is he in the right location? What can he do, and what can she do to help as a caregiver to speed up his recovery? Does she need to be thinking about alternate accommodations, and is there a literature out there, scientific literature and web products that can help her, or evidence summaries that can help her understand how best to help her father through this transition? Bruce, he lurks on the internet. He's embarrassed to ask his doctor about erectile dysfunction, but he wants to know. And the comfort and security and the privacy of being able to look that information up, credible sources of information, not just the Google search with the advertising that comes back, but actually credible information. What web products can he go? How can he learn about what would otherwise be an embarrassing thing that he wouldn't ask about? But he wants to know, and he wants to get credible health information about it. Barbara's very engaged. Her husband's just been diagnosed with mild cognitive impairment. The brain games, are they going to be useful? Brain training? She's not so sure. She needs resources as a caregiver. What about the multiple medicines that he's on? She finds it helpful when she can see in the blog there's information about polypharmacy or multiple medications. There's information and what evidence says about preventing delirium, which is now something that her spouse is at risk of. And she wants to learn a little bit more about these brain training games and apps. What's the story behind that? Deborah's a public health professional, and they've just started a new initiative on injury prevention, falls prevention, what Dr. Kelton alluded to in terms of the carpeting. What does the evidence say at the public health level, though, when they're looking at implementing strategies to help the broader community? So Deborah can avail herself of the professional search engine and the professional databases to come up with strategies and find the best systematic reviews to help them plan a public health intervention. Anne is also struggling a little bit. Elders in her inner city are looking at housing, and they are trying to come up with policies that will help them figure out what are some of the effective interventions that can help keep people in their homes longer. And again, the portal gives access to the best evidence and this hub of credibility that can guide decisions for the individual or the caregiver or the individual patient, but can also guide people at the community level and guide people in terms of health systems. And this will also, as a resource, to help people in countries around the world, just as John's been doing for years. Dr. Marcus gets visited by, let's say, Mr. Kelton, and wants to access on his mobile device information about what does the literature say about driving, because he's been asked about seniors and driving. Can he do a quick search prior to the appointment or during, where he can find out, look, is there any best evidence, randomized controlled trials, anything that says a systematic review that can give some guidance when people are there. He prints out an evidence summary and has a conversation with the family during the encounter. And that's some of the feedback that we're getting from the user testing about how people can engage with this hub of credibility across individuals who are looking for optimal health, caregivers who are looking for credible information and information and evidence summaries, public health professionals who need to guide treatments for communities, individual clinicians, and people at the policy level. So we're grateful, very grateful for the gift, for your trust and faith in us. And as I say, I think this is the gift that we'll keep on giving, not just because it's been exhausting and will keep being exhausting, but I think we're entering really a new phase of listening to the users. We know that there's a lot that we're going to be learning about over the next year. There'll be changes and developments, which is exciting for us because we want this to be impactful and meaningful and used as much as possible. So again, thank you all for coming. Thank you for the generosity of the gift. We have many of our team members here to act as demonstrators, so feel free to tour to any of the stations, and you can either volunteer your interest, a particular topic if you want to look it up, or people can walk you through some of the features of the portal. And again, enjoy the evening and the rest of the symposium tonight, and for those that are participating.
And that's it. You've said it all. Enjoy the food and drink. Thank you.
Thank you very much.